today that the most important operation that I'm performing is the liposuction for body shaping surgeries. While it's a main operation for us, sometimes it's a supporter operation in lifting surgeries, especially to improve the results and make a more better achievable results for the patients. I would like to talk about something about the historical development of liposuction surgeries. So the history is it's about the last century's history. The first try about the liposuction is done in about 1920s by a French doctor. He did try a liposuction with a very thick and very traumatic cannula, and unfortunately end of the story was like an amputation of an extremity, and for that reason it didn't try it again for about maybe 50 years more. And after 50 years time, in 1970s, an Italian gynecologist tried a liposuction with a finer, thinner cannula and large syringes and aspirating the fat from underneath of the skin, and that was less invasive but it was not that much successful technique also. And after a couple of years, in 1985, an American doctor named Jeffrey Klein found the tumescent solution and tumescent technique of liposuction, which is the technique that we are using nowadays also. And with that way, with the tumescent technique, the tumescent solution is including epinephrine and then lidocaine, which is a local anesthetics medication. And with that tumescent injection technique, the bruises is getting less, bleeding is getting less, postoperative comfort is being much better, and all kind of complication rates are being less thanks to that technique of the liposuction. And after a couple of years, in 1990s, there was some kind of technological improvements about the liposuction assisted machines. The first machines were an ultrasound assisted and laser assisted machines. These machines helped us to melt the fat, subcutaneous fat tissue, and remove it in better way and more easily to out. These machines were making a heating effect on the subcutaneous tissues, which is making more skin tightening also. That was an amazing and too much useful machines to help the liposuction procedure make it more easier than before. And after about 1 decade, after 2000s, some kind of different machines developed, and they did help us to remove the fat more easily and faster also. The most useful machine was the power assisted liposuction machine, which is making the fat in peace with just only mechanical energy. And nowadays we are using it pretty much. I'm using it, the power assisted machine, in every single operation, and not for only the liposuction. I'm using it for tumescent solution infiltration and for fat injection and for BBL surgery also. And for the last recent years, the skin tightening machines are also developed very strongly. The biggest problem in liposuction patients especially was the moderate skin quality or moderate skin excess patient. If the skin excess is too much, so you can do tuck surgery or lifting surgery for abdomen, for arms or thighs, it doesn't matter. If the skin excess or skin looseness is not exist, so you don't need to do anything, just a liposuction procedure would be enough in most patients. But if the skin is not too much or too less, if you have a moderate skin quality or moderate skin excess, in that way the resolver as a new, it's a very strong weapon for us to make a tightening without doing any kind of lifting surgeries. It's a lifesaver machine for us for that kind of moderate skin quality and moderate skin excess patients. So this is the last 1 century's liposuction development history, and thanks to the developed technology and the surgical techniques, we don't need to amputate any kind of extremities like 100 years before. And every day we are developing ourselves, we are making our experience much better, and we are achieving more results with less invasive techniques, and day by day hopefully it will be better and better. Today I'm happy with the machines and with the techniques, with the experiences of our doctors in all around the world, but hopefully in future it will be much more easier and comfortable and satisfactory than now. So that's all I need to explain about this thing. Hope to enjoy with the video and find it informational, and if it give you a benefit, so it's too much happy to me. Thank you. Bye bye.